This is Dr. Chaudhry from the Foot and Ankle Wellness Center here in Edmonton, Alberta. So today I wanted to talk to you guys about diabetic patients with diabetic foot problems. And the thing about diabetes is that it is such a vast disease. It can affect so many different things. It can affect your heart, your lungs, your kidneys. It can affect your circulation. There's so many different specialties out there. There's endocrinologists, there's diabetologists, there's internal medicine specialists, and then there's podiatrists. Podiatrists are very, very well trained for foot care in terms of diabetic problems, and that's what we'll talk briefly about today. All right? So just to give you a little bit overview of how vast the diabetic problems can occur, they're the number one diabetes complications. It's the number one cause of blindness. It's the number one cause of heart disease and stroke. It's the number one cause of amputations, trauma, outside of trauma, and sadly, it's also the number one cause of kidney disease in North America. And unfortunately, it is the 7th leading cause of death in North America. All right, so that's how devastating it can be, just for that one disease. So with podiatry, let's talk about what we see in foot patients with diabetic problems. Number one is nerve damage. Number two is blood circulation. So nerve damage, when it happens there, is something called diabetic peripheral neuropathy. And diabetic peripheral neuropathy is when the nerve sheaths are swollen with fluid, and the sheaths being the wrapping around the nerve. And when those nerve sheaths are filled with water, what happens is the nerve slowly gets strangled to death. And when that happens, the nerve cannot function as well as it should. It tends to start sending out shooting sensations, tingling sensations. Patients will experience burning. They can't sleep at night, numbness, and then that can cause you to have ulcerations or abrasions on your skin, on your feet, which can eventually break down into ulcers, really deep wounds, which can eventually get infected, which can turn into gangrene, and then eventually leading to amputation. All right, so that's diabetic peripheral neuropathy. The second problem that can occur, that we as podiatrists see a lot of, is peripheral vascular disease. Peripheral vascular disease mainly meaning the nerve, the blood flow to your feet from your legs tends to become weaker. And what happens there is that you have calcification of the blood vessels. Calcification meaning calcium lines the walls, the inner walls of the smooth muscle of the blood vessel. And so the blood vessel, which is a very fine, flexible pump, turns into a lead pipe. And that lead pipe decreases the amount of blood flow through it, and that it causes toes to turn blue, to turn pale, or even what we call cyanotic. And that can cause circulation problems, where once again you'll develop ulcers, you'll develop abrasions, you'll develop infections, and gangrene and amputation. So if the blood flow isn't getting down there, the nerves aren't functioning as well, you're going to have some serious problems with your feet. And that is why with diabetes, that is the number one cause of amputations outside of physical trauma. So now that I've scared you all with the complications of diabetics in terms of foot problems, there is good news. The good news is that most of these conditions can be reversed. If not completely reversed, they can at least be treated and to help avoid those traumatic amputation type conditions. And how do we do that? Well, there's a lot of simple things that we can do. All right. So the first thing that we can do is to self-inspect, meaning you yourself look at your feet every single day. If you can't see as well, because remember diabetes is the number one cause of blindness, then you must have someone else take a look at your feet. And what are you looking for? You're looking for any signs of abrasions, any signs of red areas, any signs of where the skin is thinning out and it's tending to break open, if there's any pus coming out of a wound site, if there's something that isn't, if there's a cut and it isn't healing, all of these things you may not be able to feel, so you got to be able to at least see them. All right. Second is to be able to visit your foot doctor. And when you see your doctor, they can, there are simple things that we can do to help avoid things from getting worse. If we see a wound that isn't being treated properly, we can help reverse that process by cleaning it out, applying the appropriate dressing, and then allowing that wound site to heal. And we have those treatment modalities in our office. How often? The second question most patients ask is, how often do you need to see a foot doctor? My answer is usually when you have a healthy diabetic with a healthy foot, you're still at risk. However, you can come in about every 1 to 6 months just to kind of keep an eye on it, make sure nothing sneaks up on you. However, if you have difficulty cutting your toenails, if you have difficulty cutting calluses, or if there's a nerve type problem or circulation problem, I would suggest coming in for treatment for those problems every 4 to 8 weeks, depending on the severity of it, and that way we can keep an eye on things too. The other important thing you need to understand is to always make sure that you have your proper blood sugar controls and take your medication. So with these simple things, we can do so much to help avoid amputations and diabetic foot complications. You don't need to live with foot pain, and especially diabetics these days. So once again, this is Dr. Charyar Chowdhury from the Foot and Ankle Wellness Center, wishing you a great day, enjoying the sunshine here in sunny Phoenix, and I want you to always know that we are there for you. Thank you so much.